Thank you and good afternoon, everyone. After the lovely video and the lovely presentation, I have a minor criticism to do. In a country with such a wonderful natural light, how can we be here with this terrible light? Sorry, that was, maybe we can consider opening some windows somewhere and benefiting from this. That will be so good for our mental health. And that's the end of my presentation, because in fact, I made already very clear, I think, the connection between the environment, the parks, and the health. Anyway, let's go to the serious business now. I'm extremely happy to be here today. And the reason of being together this afternoon on this very important topic gives me a lot of hope, because as you can see, there are fantastic benefits from associating these two agendas, nature and health. And let me tell you a little bit why we need you so much, and maybe you need us a little bit as well, and then together we can make a very strong case for more action. You saw on the video, the first one presented by the World Health Organization, that 24% of the global burden of disease is linked to exposure to environmental risk factor. This is not a very small number. This is a horrible number. I'm trying to escape from those horrible lights, but there is no way to do it. So anyway, sorry. I was saying that 25% of the global burden of diseases, which represent 12.6 million deaths every year, are associated or can be attributable to exposure to environmental risk factors. What are those environmental risk factors? Obviously, air pollution, lack of clean water, and sanitation, which for many people around the world is still a major problem. It doesn't seem to be a problem for you here in Australia, but in other parts of the world, believe me, it represents a major risk. Is exposure to UV, and again, Australia is giving us a very good example on how to go for prevention strategies to reduce exposure to UV and skin cancer and melanoma, so bravo for Australia on that. We are using you as a pilot country on this and as a pioneer, so we need more good examples that we can exchange with others. Going back to my argument on the environmental risk factors, there is no excuses now that we cannot say that people didn't know that exposure to environmental risk factors were representing such an incredible danger. So probably in few years from now, and I hope that it will be not a big number of years, some politicians, policymakers, all of us as members of this society will be made accountable and responsible for saying, if it was so clear, if it was so obvious, why you didn't do more? And I hope that this afternoon together we can start to propose more measures and more action to be able to respond to that embarrassing question the day our citizens will ask us about that. This is the life of many people around the world every day. They wake up and they cannot see what is outside because the cities where they live are terribly polluted. If you are a citizen of Lima, Peru, or Mexico DF, or New Delhi, or Shanghai, or Beijing, or I don't want to blame anyone specifically, but in many cities around the world where a big percentage of the world population is living your daily life, which will very much about not seeing the fantastic blue sky that you see here, or the fantastic parks that you have access every day, but it will be breathing an air that is kind of causing you a lot of disease and damage, and obviously socio and economic disruption as well to your country. This is the life of many people around the world. Actually, 90% of the global population is breathing air that is not respecting the standards proposed by the World Health Organization in terms of quality of air that will be good for your health. So 90% of the global population is breathing air that is going beyond the standards and the guidelines proposed by the World Health Organization, which are endorsed by many, by the way. Another thing that is happening every day for many people around the world is that they wake up, and instead of doing this, which is the first thing I do when I wake up, apart, of course, of controlling my iPhone and whether I have WhatsApp message, which is the first. The second will be to do click and have electricity, have a light in my room or in my house. For 41% of the people around the world, this is not the case. And if you want light, and if you want to cook and you want to make not a coffee, but something to drink in the morning, it's not just going to the kitchen and again doing this on a very digital way and getting your coffee machine and start to work or your Nespresso or whatever. Is more complicated. You need to get out very early and you need to walk for kilometers sometimes to collect wood or to collect charcoal or to collect whatever is available in order for you to make an open fire. And then with that, you will be able to cook your breakfast or your daily meal or whatever. And getting that back home, every day going a little bit further on that. And obviously by doing so, spending a few hours a day and stopping you for going to the school and getting education. Normally, the ones that are doing that are the girls. So this is where most of the population, 41% of the global population, is still relying on this type of fossil fuels, very dirty fossil fuels that are polluting their environment at the household level and making their life very difficult and very complicated. Another thing that is happening every day is that more and more, a big percentage of the population is waking up in a place where it's called an urban or peri-urban area. Most of them, they have moved to this peri-urban area because they thought that they will be having better conditions for their life, for their education, for their health systems, for employment. And they end up realizing that they are on a kind of very terrible poverty belt around the city, around the urban area where those services are not available and where life is even more violent, more complicated. So those very dangerous slums that are not planned are affecting the life of all of these people. And we need to be aware that in 20 years from now, more than 70% of the global population will be living in urban areas. So how can we make sure that those realities that we see every day, are we confronting that and are we putting the good ideas and interventions and movement and actions in order to change this panorama that doesn't look very optimistic for many people around the world? The other trend that we cannot avoid if we talk about public health and defining our priorities is the fact that our population is becoming overweighted and obese in many cases. And this is obviously related to the caloric intake that we have every day, our lifestyle, but it's very much related as well to the fact that we cannot walk. We cannot have an active lifestyle. Most of the many pediatricians or endocrinologists or doctors who are working and to reduce the prevalence of obesity and obesity-related diseases, they will recommend to their patients, oh, you need to walk, you need to practice a very active lifestyle. They say, well, but I live in Manhattan, you know, or I live in Lima. How do you want me to walk? How do you want me to have a physical activity or to practice a minimum on going by bicycle or walking to my work or doing something a little bit less sedentary than what I'm doing now? And this is, again, where the connections will be very, very clear. For us, health and environment are intrinsically linked. There is no way to discuss about that. We have plenty of benefits from having a healthy environment. Will generate a healthy people, healthy population. A healthy people will contribute to a healthy environment. A healthy planet will be equal to healthy population as well. But healthy parks, healthy urban planning, healthy green spaces that we can offer to our citizens will definitely contribute enormously to that. The benefits of parks and green areas are very well demonstrated. One of them is clearly related to the mental health, the space that this will provide, the possibility of having a more active lifestyle, the possibility to having some social interaction with other people, which is one of the major difficulties on the big urban areas where we are living now, that people cannot interact because there are not simply spaces for that. So the benefits are enormous, and I'm sure that Cristina Romanelli will tell you later on the job that we did together on the Commission of Biodiversity and the World Health Organization of looking at biodiversity and health and how we can interact on that. The science is there, the evidence is there, the data that I was presenting to you, which was not, I'm afraid, very optimistic, is there. So what next? Certainly, we will not keep on being pessimistic or passing catastrophic and apocalyptic messages and being Al Gore again. I think we need now more type of, I have a dream or something like that. And we need a Martin Luther King approach and people very optimistic and saying, I have a dream, but I have a dream, I have a plan, I have the way to implement that plan, I have some ideas, but I know how to implement it, and I have the resources to do it. This will be really a very superhero more than Martin Luther King. But I think we have a good dream, we have a good plan, we have the good arguments, we need now the good tactics. And the good tactics are, one, getting together, these two communities, and I'm talking about the biodiversity, ecosystems, the planet, the environmental people, and the parks people, because the parks people, they can give us very concrete examples of your Indiana Jones that we saw in the video. Where are they, by the way? It will be nice to see them, the Indiana Jones that you were describing in the video. Wow. No, the Indiana Jones, no, I was thinking on the Cocodrilo Dandy, sorry. Okay, that helps on the promotion of the video, I'm sure. Okay, so we need to use those examples on a very concrete way, proving how those teenagers were happy to be in contact with the nature again, how they can find that the simple things that sometimes behind an iPhone and a WhatsApp and an internet we forget about, how those things can be fantastic again and produce a lot of well-being, health, and even happiness. So associating this community will be the first tactic. We need to work on very simple messages, very pragmatic to prove that it's not just a dream, but we have a very clear plan and a very clear roadmap and very good results that we can share and feed back to others. Second is that we need to change the way we communicate with the citizens. The general population is the one that will be changing and transforming our society, and if one day we move on a more sustainable development, it will be not because the United Nations decided to have 18 SDGs. No, it will be because the society will demand us and will be putting a lot of pressure, don't worry, very positive pressure on our politicians and the responsible ones for taking policy decisions and making policy choices at the country level. So a well-educated population, a population that understands that our language is not just a philosophical one and saying how wonderful it is to protect the planet. No, we need to explain to them that there are a lot of health benefits associated with this protection of the planet. Or the other way around, there are a lot of health benefits that can be obtained if we treat a little bit better our planet. And even if we treat our planet a little bit better, I think the benefits will be enormous. So that's the second tactic I would like to promote. First, getting together. There are many alliances now that are created. Health and environmental ministers are being put together at the World Health Organization in Marrakesh at the Climate Change Treaty. But there are other opportunities to go together with different organizations and going beyond the health sector, which is normally the one that, as the World Health Organization, we work with and associating with others. The second tactic will be best communication. And the third one is start to be more ambitious than we have been until now. And I think, again, if we use the health argument, our ambitions shouldn't have any limit, because it's difficult to change legislation or to convince people to take measures that will have an economic implication if you talk about the future of the planet. But if you say, this is about the future of your lungs, this is a language that people understand. And this is about the health of your brain, the health of your lung, the health of your heart. This is something that we can use more, the need to reduce air pollution, the need to reduce pollution in general, the need to have a more sustainable development is all related to our health and well-being. And those are the arguments I think we need, and we have the capacity to explore a little bit more, and then having the dream implemented. Thank you very much for your attention.